UnityPoint Health St. Luke's Hospital is excited to announce a $25 million expansion of heart care services and vascular services at the Nassif Heart Center.
We are really excited about this Heart and Vascular expansion project because it addresses a number of both opportunities and needs, I would say. The $25 million ultimately will be divided into roughly halves. Part of it will be for renovation of some existing spaces, and the other half of it will be for the addition of equipment to support expansion. We're going to make great use of space we have available. We're not adding space, we're reconfiguring spaces. So these are dollars that are going to be very, very well spent to allow our teams, physicians and other team members to do their best work in support of what's always been an important legacy service line for us and one that happens to be growing tremendously as well.
This is going to involve expansion of heart care services along all of our service lines. It includes expansion of new vascular labs, an expansion of our current coronary labs and our coronary procedures, an expansion of our electrophysiology labs with an additional lab being added, and a new hybrid lab, which means that it's a partial endovascular treatment area where we can do a lot of our structural procedures as well as a surgical suite, so it's a combination of both.
We are just really blessed beyond measure to have incredible cardiologists, a great degree of training, a great degree of subspecialization, just absolute rock stars really in terms of being able to deliver the highest end of cardiovascular care. So we need the spaces and places for them, for our cardiothoracic surgeon, for our vascular surgeons, for our interventional radiologists to be able to do their work.
This commitment allows us to continue to recruit some of the highest trained specialists in the country, and they're drawn to this area because of our commitment to specialty care.
We really are a leader in heart and vascular care, have been for more than 40 years. We often talk about having the first open heart surgery program in this community way back in 1978 as sort of that milestone that set our leadership and innovative position in the market, and that's true, and we've just continued to build on that year after year, decade after decade ever since. We're in a position right now where we have just a tremendous group of cardiologists, just so well trained, tremendous subspecialty representation. We are better positioned than just about anyone that I can think of in Iowa to be able to provide great care, high-end care in our community hospital setting.
This continues the commitment that St. Luke's Hospital has had for over 45 years in caring for and being the advanced and expert in cardiovascular care. This also puts us on good footing for the future of cardiology. The advances in cardiology have been growing exponentially. The future of cardiology and cardiovascular care continues to expand, and this shows again St. Luke's commitment to keeping up with the changes and the advances in technology and services.